Hi, my name is Heather, and today we are going to be talking about bed sores. Bed sores occur in people that are, as the name would hint, are bedridden, elderly, some hospital patients, and bed sores occur because the area is getting a decreased amount of blood flow that ends up hurting the tissue. So our skin has three layers. We have the epithelium layer, which is the epithelium, which is the very top layer. This layer is avascular, meaning it does not have any blood vessels and it receives its nutrients from the dermis. The dermis is the second layer of the skin. It is vascular, meaning it has lots of blood vessels. And then we have the hypodermis, which is the last layer, and it is avascular and also receives its nutrients from the dermis. Now, the avascular tissue, mainly the epithelium in this scenario, gets its nutrients from the stratum basal that gets pushed up through the layers. Now, the original cell that's in the stratum basal is a stem cell. That stem cell undergoes mitosis to produce two daughter cells. One daughter cell remains in the stratum basal, while the other daughter cell is pushed up through the epidermal layers. In this way, the dividing stem cells push the products of mitosis up through the epidermal strata. Now, to get rid of waste of a certain kind, a similar process can happen where as the cell gets further and further from the stratum basal, it gets closer and closer to death until it eventually dies and gets sloughed off. Another way our integumentary system gets rid of waste is through sweat. When we sweat, our bodies are able to eliminate a small but still significant amount of waste and toxins through excretion. Now, as I mentioned in the beginning, bed sores are caused by decreased blood flow. The effects of decreased blood flow are felt by both the avascular and the vascular tissues. This is because the vascular tissues are the ones that directly receive the nutrients and then divvy it out to the avascular tissues. If the vascular tissue itself is not receiving enough nutrients, there's obviously not going to be enough to go around for everybody else. So all of the tissues are going to suffer just from the dermis being cut off from that blood flow. There's not going to be any oxygen coming in, or if there is any, it's not going to be enough, and there's not going to be enough nutrients. Now, just to rephrase that, if there's no nutrients for the vascular, like the vascular tissue, the dermis, there's not going to be any nutrients for the avascular tissues to receive. No nutrients, no life. Bed sores do have multiple stages. They range from stage 1 to 4. At a 1, a bed sore is going to look just like a dark red area of the skin. It's going to be painful. At a stage 4, it's going to be a big, deep hole in the skin, can be black in color, and in some severe cases, you'll even be able to see the bone. At this point, the lack of nutrients that the specific area experienced has caused that area of the skin to just die completely. I do have a visual representation of the different stages of the bed sores. So here you can see in a stage 1, it's just the epidermis being affected. In a stage 2, it reaches the epidermis and the dermis. A stage 3, it's going to start going even further. The entire dermis is going to be infected. And at a stage 4, as you can see right here, this is the bone. The bone will even be visible. By the time, it's not going to bleed a whole lot, because by the time this happens, or even this happens, by the time a bed sore occurs, the blood flow will have been cut off significantly or reduced to the point that simply moving is not going to bring back the blood. This means that even though a bed sore may be open, it's not going to bleed because it has no blood to give. The supply at that point has been cut off for such a long time, it's not going to come back just like that. One way to avoid bed sores for sure is frequent position changes. This works because it allows the blood to reach all areas of the body, not cutting off nutrients to a specific part of the body. If the patient is able, it is best to actually have them get up, walk around, perform some exercise, really increase that blood flow. I hope this helped with some of your questions. Thank you.